I need to know everything, who and the what and the where, I need everything. Trust me, I hear what you're saying, but act like it's new what you're telling me. I'm curious, George, I hop in the Porsche, it's 5 and a horse.
That you're doing is like so vast, it feels like. But I know that everything is actually very specific. Yeah. And I think that's interesting from a person's perspective that isn't within the science world, because everyone is professionals and niche. Even companies or institutions sometimes find themselves like in niche spheres. Yeah. But I hear like cancer prevention, I can understand it to a certain extent, but I know that I actually don't know when I'm hearing things like that, of what we're really talking about. So this is Banter for the People, bringing in interesting individuals that are just creating like different change in culture, pushing forward towards what our tomorrow looks like, hopefully creating more good than bad. And we got Mark in the house today. We're actually at Mark's house at this beautiful building, somewhere in UCLA campus.
The Hammer Museum.
The Hammer Museum. Yeah. When I walked into the lobby, it was unbelievable. Just like the design aspects that were going on with the museum. It's kind of cool to be able to be like, you're in a medical building a little bit, but then having all like this bouginess kind of reminded me where I'm from, Rochester, Minnesota.
Yeah, and that's the great thing about UCLA, and it sort of coincides with our discussion today. We're such a small footprint in that, it's a small campus and everything's on one site.
Yeah.
So you have this integration between art, sports, celebrity, research, but it's all par excellence across the board.
Right.
So the fact that this was Occidental, an old oil building that now has the Hammer Museum, Alice Waters restaurant.
Yep.
And then South Campus is 5 minutes away
Mm-hmm.
for all of the medical research.
Like I was telling you before we started and turned the cameras on, from Rochester, Minnesota. So, home of the DMC now, the Destinational Medical Center. Our town's always put a lot of pride into where the future of medicine is going. And I grew up in this very unique community where a lot of my friends and family were in like double dock households, or one friend was a scientist. Like one of my best friends from high school, his dad started he brought the proton beam into Minnesota, which is, you might know more about it than I do, but somehow can kind of zap cancer. And it's this whole building that's almost like a 5 to 7 story building that most of it lives underground. And it's all dedicated to like this very specific point. I always love the little like competitions between, what's happening at UCLA, what's happening out in Boston, because Mayo Clinic's pretty much all that Minnesota has outside of Target now. We always feel that little bit of a competitive nature where we're still trying to hold the fort.
Absolutely. And competition's healthy.
100%.
As long as everybody is aligned on the same focus, which to me and for most people, right, it's about new drugs for patients.
Yeah.
Patients don't care where drugs originate. So as long as that competition sort of, rising tide lifts all boats.
Yeah.
That we're competing for the greater good, but then collaborating when it really needs that synergy of expertise, resources, capabilities, and whatnot. And as a side note too, we have like one of the best electron microscopes on the campus of UCLA, which
really
again, is underground. That
I think like all the like interesting, mysterious stuff always has to happen like 3 to 5 levels below ground.
Oh yeah, and there's I won't name the building, but I always tease that part of our LA Best tour would be, can you get through this, level B area?
Yeah, like can you sneak in?
Dark and damp and lots of history.
So your expertise, it seemed kind of vast to me, just kind of reading your bio. Just tell me about like, what is your focus and how you got to this place where you're kind of pushing the forefront of like cancer prevention and all the other various things.
It's interesting. I tell people I wasn't born at age 5, like, dreaming of being a doctor, firefighter, whatever. And you say,
okay,
dreaming of being in tech transfer is probably novel and unfamiliar to most, including to me.
And what in tech transfer in itself, like that's a term
exactly.
that I'm not familiar with. What is tech transfer?
Well, what's interesting with my background, because I have a science background, immunology. I also have a business background, both from UCLA. I grew up in Chicago. So
okay.
to say
yep.
Midwestern roots.
That's right.
Came to UCLA and then never look back. Love Chicago, of course, great city.
100%.
But
I always say, a lot of people, for some reason, you hear people in LA saying they're running from something. I'm in LA because I'm chasing something, right? So it's like, I'm not running from my past. I'm chasing my future. And it sounds like that's kind of similar to you.
That's an exceptional, I guess we'll have to plagiarize that at some point.
Yeah, sure.
That's a great, because that's sort of going to the whole tech transfer and words evolve. So basically, in essence, with tech transfer, with what I do, with leading the life science therapeutics diagnostics area within UCLA, tech transfer was established because you have all this great research at UCLA, billions of dollars of federal funds, grant funding. And I laugh because, just to show how powerful UCLA is, network, brand, and whatnot. When we celebrated our centennial anniversary in 2018, the UCLA goal, this is not me, was to raise, I think it was $3 billion in philanthropic donor funding.
Yeah.
We closed at 5.5.
It's so funny that you say that, because I remember I had a discussion with like our mayor of Rochester when at the same time we raised the funds for Destinational Medical Center, which at the time was $5 billion, but I think it's even like grown to probably like $7 billion now. The Minnesota Vikings had just landed the deal for their $1 billion stadium.
Mm-hmm.
And that got the front page of the paper before this. And she's like, we just raised 5 stadiums for the future of like medical advancement. And these goofballs played football. I'm the biggest football fan in the world. Yeah. But she's like, these goofballs playing football are the people that get the headline. And, we're changing the future here. And so the money that you're talking about is it's astronomical. But that's what it takes to be able to. It
does. And it takes a community. And I think this is what's key, because at some point in this hour, hopefully I'll get around to answering your question of like what tech transfer is.
Right.
But when I say the evolution, it goes sort of to what your reference with sports, in that it's needing a community to develop new drugs, because the diseases that we have now are so complex that you're seeing they're more complicated. But still, that community can extend to the sports fans, right? The Michael J. Fox Foundation for Michael, you know what I mean?
Right.
Healthcare is important to everybody. So in my mind,
it's one of the only universal things we're all affected by.
Yeah.
Right. At some point, it's going to play the biggest factor in our life, which is like, how can I not only experience a life of happiness, hopefully also prolong that?
Yeah. And quality of life over quantity. So with tech transfer in the beginning, where it's like, oh, there's all this great research, it's not being commercialized in a way for societal benefit, was recognition like, oh, let's establish these tech transfer offices. Again, this is like 1990, to have the authority to do that. So the inventions that come out, we're in charge of licensing to the industry. So whether it's, in my case, biopharma to develop new drugs, or my counterpart, Dina Lazovsky, he oversees physical science that can apply to, semiconductors, climate change, whatever, those areas. But even with that, it goes to the static nature of, you have researchers who know how to have breakthroughs in science. That's not the same as business and commercialization.
So when you say that, are you opening up the data that these researchers are curating and then saying, we need more like private industry to come in and curate product from it?
Yes, but in a way that, and this goes back to, in my role, I'm at best a jack of all trades, because across life sciences, there's a lot of, I'm the first, there's so many smarter people than me.
Sure.
But to be at the cutting edge of everything from infectious disease to cancer to neuroscience is just too much. What we're orchestrating is sort of Pasteur, chance favors the prepared. We want to set it up such that the researchers with great research programs, collaborations, we're teaching them the fish in terms of, all right, you've got this great research. How do you pitch? How do you present yourself with credibility, such that when you bring in biopharma, the investors are like, yes, we want to collaborate with you.
Got it. So really helping, articulating the opportunity of like what this research is pointing to, and saying, if we can like reconcile this the right way, like there's profitability in this at the same level.
There is.
In profitability, I look at more in medicine as stability, right? Because it allows something to stabilize itself to then continue the future, because we continue to have the brightest people in the world be interested in medicine, not only for the journey of being able to be on the rocket ship that's, changing the world, but also it has to be able to support a family and be lucrative and
Yes.
and feed those egos, because shit, medicine has just as many egos as football does.
Yeah.
And almost on a higher capacity.
And you can choose to invest in building a stadium, right? And if there's more profit, so it's not a judgment right or wrong, but it's just the reality that, to your point, sustainable and whatever profitability, access, and all that means, but recognizing that those are drivers. But I think your word journey is the key, because the tricky thing with this is that this is not, this is sort of like dating, long-term dating in some ways, for analogy, in that, sometimes there's great breakthroughs like, CRISPR or something like that, or that it's recognized immediately, like, oh, this is powerful. But the way I look at this is setting up a relationship that if you pitch right and have credibility, that there'll be an engagement, because it's a journey from, okay, you're doing a very early stage research program, observing something or trying to figure out what causes the disease, to then saying, oh, now we know how to treat it, or, diagnose it or something. And that in and of itself, it's beneficial to have people from business input.
Sure. Because then it's also like you're building that team of surrounding minds that having different types of input.
It is about
that
the
then
team.
Change this trajectory, whether they're applying pressure or they're, seeing other insights in different avenues that this research could go into, right?
Yes, and it is about building that team. And also that changing the culture requires changing the understanding, recognition for the faculty, the researchers, that it does require a team, and having a team is important, because
everybody wants to be a quarterback.
Yeah.
I mean, every leading scientist, which you're working with all of the world's best in all of their different capacities. It's like, how do you get that whole cohesive group and you're not working together in seasons. Like, it's not 6 months and let's go try to win a Super Bowl. It's, look, we need to go on a journey for maybe 30 years together to be able to actually accomplish some of these goals. The strategy behind trying to hold that together is colossus to me.
It is. And also, even with the quarterback analogy, the researcher is still going to be the quarterback, but it's the other complementary components. And so, for instance, part of my job with tech transfer is that if a researcher thinks that they have a new invention, which could lead to a patent, I ask them, like, first thing is reach out to us early and often, because as part of that journey, it's not a yes, no answer. What we say is like, oh, you've observed this mechanism that a part of this disease, let's say it's diabetes. Oh, now we understand how the islet cell might be changing that impacts, the insulin secretion, blah, blah. That's not patentable because it's an observation. But I'm glad they reached out to us because, one, biopharma might be interested in still collaborating with you on that. And that's something we can explore. Two, we convey to them when it is patentable, because then they know when that trigger point is. But as part of this journey, with each of this roadmap that's very nascent of like, okay, from research to a drug, having those other stakeholders, those other, contributors, whether it's IP attorneys, the investors along the way. And also you're building that relationship because it is a people game.
Yeah.
And I tell you, as you know, in the news, there are some people who, sometimes peddle snake oil.
Sure. 100%.
The earlier you build a relationship and can understand that person, whether it's, their brilliant eccentricities, whatever this and that, again, you build a working relationship, and that also informs of when, how, to form a company. And it also helps with the whole drug development process because you've established your team before you needed it.
Yeah. That's what is so interesting about your field is we all are universally affected by it, but we all have the thinnest layer of vague understanding of what actually is happening. Right. So people will obviously call 911 every single time that they feel like they're having a heart attack. But then at the same time, they'll also say F big pharma, right? Like they don't have my back. It's like, and then, but you don't realize that these institutions are all working together in greater capacities to be able to hopefully always create a positive future for you. But we only know those differences where it's like, bump my elbow, go to the hospital, and then there's these variety of different pills and stuff that I'm supposed to take that are a doctor's telling me I should do. And there's always this kind of 50-50 right now of should you do it or should you not? Science prevention, I think, even gets so much more vague in people's understanding of really like where we're at and what's possible.
It is complex, and that's the thing, because diseases are complex. So I guess probably the general population, thinks in terms of drugs as, sort of like with tech.
We start with Tylenol.
Yeah, you
right?
start
Like
with Tylenol.
drug.
Yeah.
Okay, Tylenol.
Yeah.
Got it. Cool. That's my beginning.
But when you look at the efficacy of a drug and to say, okay, it works for some, it doesn't work for others, and then you're trying to decide whether to approve it or not, that's more of a shades of gray. So it's not going to work every single time.
Yeah.
But having said that, the hope is with drug development, the way it's proceeding with these more targeted, specific, unique, per person drugs, that you'll be able to begin addressing that. So for instance, chemotherapy, one of the most basic approaches to treating cancer, you're basically trying to kill the cancer without trying to kill the person, because
It's fine line of like, let's put the person in a microwave quick, and we'll make sure the cancer is hopefully gone before the person is.
And to use jargon, which I shouldn't do, but
I'll do it for you.
Not targeted, right?
Yeah.
That's a very carpet bomb approach. But then with the new forms of cancer that are coming out that are much more like immunotherapy, that's where you're beginning to target, because you can really begin to say, oh, we can recognize this cancer cell specifically from a normal cell and hopefully just kill that.
Now, what is confusing of the idea of like cancer prevention to me is that it feels as though these institutions are still caught in the idea that a person comes to you once they're already sick, right? So I understand curing or, giving therapy and, doing preventive, or it's not prevention at that point, right? Like now we're trying to like solve the solution. How do you prevent something from a population base that is only going to come in after they're like limping? You know what I mean? It's like you can't put an ankle brace onto someone and say, now they're not going to sprain their ankle anymore. They're only going to come in after they sprain it. Yeah.
And actually, not to avoid answering the question, but it's even more complex, because if you think about it, cancer is a result of runaway development. So in other words, your skin cells, your beautiful beard, it's growing all the time. If it doesn't stop growing, that's when it becomes cancer. So you have to decide, okay, at what point can you diagnose and say, oh, this is past that point of normal development? Because a mole is precancerous, right? But you don't cut off every mole.
Yeah.
You scan it. So early recognition is key, but also even making that decision of when it is a disease, because so many of these chronic diseases, obesity leads to diabetes, which increases your risk of cancer. At what point is it a disease versus, it's a lifestyle thing that can mitigate that disease,
right. Because we all currently still treat obesity similar to having dandruff.
Yeah.
You're like, shoot, like, I got some dandruff. Let me go get some Head and Shoulders, or maybe you don't even go get it that week. You figure it out in a month.
Yeah.
And the way that we're treating our body, even though we all are seemingly getting more educated on the good and the bad, we're like, soda's negative. You shouldn't smoke. McDonald's is going to be harmful towards you. There's cancer labels on everything that we know. But we're still dealing with the human brain that's like, gonna just still grab dumb stuff on a daily basis before you start thinking.
And also, and not to go way off topic from this, but how do you quantify stress relief? And also the fact that you can have somebody like, I love barbecue smoke, and I know that char is a DNA intercalator. In other words, it can go in between your DNA, and then when it reproduces, okay, it's an
God,
error.
that
The
wrecks a
mutation of
barbecue
it-
for
I
you.
know.
You're like overthinking the burger. It's like,
Exactly.
oh shoot.
It's like, all right, just 2 more minutes instead of 5.
Yeah.
But at the same time, it's not a direct cause. It's not saying, oh, you do that once and all of a sudden the next day you're cutting something off, right? It's cumulative.
Yeah.
And so,
So where are we in, like, is there so much to be hopeful for where we are, like, in the research within, like, various types of cancer? What particular cancers do you see on the forefront that maybe we have the most likelihood of, like, solving that particular issue? Because I don't even know how many types of cancer there are. You gotta chop out only one at a time. It's not like you're gonna solve cancer. It's
exactly. And sort of, back in the day when they'd call it, I don't know, that was a gluttony, not, I mean, they
Okay.
had these things that were just descriptions of why the person died.
yeah.
Cancer is like a blanket.
Well, because humans just got
category.
dropped onto this earth, and we just started trying to figure it out.
Yeah.
And we started fighting each other way before we started to try to, like, work with each other and figure out how to do this earth thing. So,
And I think to answer your question, I think it's going to be by the most straightforward targetable cancers. And to break that down, so the blood cancers, hematological, geez, I hope you can edit that. But basically,
sure.
those are the ones where it's like in your blood, you have the immune cells, the B cells, T cells, things like that. When they become cancerous, you're targeting those cells. And that's what you're seeing the breakthroughs with the nascent immunotherapies that have been launched over the last 5 or 6 years. The holy grail are the solid tumors. And the way I think of them is sort of like castle warfare, like siege warfare. You know how back in the Middle Ages, you'd have a castle, and if you wanted to, attack the castle, you'd have to put the ladders, the grappling hooks. They'd have all that stuff.
Okay.
That's how a solid tumor acts. They have so many defense mechanisms that you have to break down. That's why it's been it's a complex disease and harder to attack. But I think the earlier stages, I mean, the most promising ones near term are the ones that are directly targetable, like the immune cell ones, because it's sort of one type of cell.
Okay.
And you can wipe that out. And also fundamentally, earlier stage diagnosis. That's if you just look at the statistics, the earlier diagnosed with cancer, the higher survivability
Right.
and outcomes.
And that's why we have things like, if you're 40 years old as a male, like, go get your prostate checked, right?
Yeah.
So we found these kind of bigger, more regular things that we've gotten used to society just saying, like, everybody knows that.
Yeah.
Pretty much.
And I think, quite frankly, the integration of tech into biotech is going to help. So your Apple Watches and things, which those are more the maintenance, heartbeat and things of that nature. But now with the advent of AI, whereby, AI is a tool, but when you think about it being able to complement the professors that already have this great research. And remember, in the very beginning, my thesis was LA Best was putting a team together with complementary skill sets.
Yeah.
With AI, it's like, oh my gosh, now you have this wonder computer that, and I sort of equate it to potentially, the Tony Stark of Iron Man.
Yeah.
Of like, you have the cell projected, right? You're looking at that certain component of it. You're spinning it around, and we're not there yet by, that's where,
Sure.
But again, my hope is that you're beginning to integrate all that knowledge into these, projections that can inform how to target, which then informs what sort of chemicals or cells or other therapeutics can be used. And then you've got a higher shot on goal of success because you really had AI to help complement those insights and say, okay, what are the pros and cons, risks, benefits with targeting this?
Got it. So it's maybe getting into a practice more of some like one-time annual check, at least in different series of your life, to just really have key identifying markers of this is what we need to potentially prepare for. Do things like when it comes to like heredity, like how does cancer work as far as if I have cancer in my family, is like 30% of cancer patients all hereditary, or are there like really factors and numbers on that?
Absolutely. And I don't know those statistics,
Okay.
jack of all trades again.
Yeah.
But with some of the thought leaders we have around here, they will absolutely can provide you those details. So,
But hopefully, like in 100 years, it's like LJ with like who you are. We just know like these are the 5 things that we should expect out of you, that we should prepare you for your whole life. And I think
also infectious disease. You know, the fact that 100% of cervical cancer is caused by human papillomavirus. You know, ulcers used to be quote unquote caused by stress till like they discovered it was I'm drawing the bacteria basically.
Oh, okay.
Pylori. Okay, I'm not going to butcher that.
So, like, how long ago did we figure that out?
Probably the 90s for that one.
Interesting.
For the ulcers, yeah. And with HPV, that's probably in the 20 or 30, but now we have the vaccine for it.
Yeah.
To prevent, cervical cancer. So I think there's 3 or 4 components that as, again, we begin figuring this out, and this is where the research complemented, whether it's by AI or, other factors, can help distinguish, cause versus correlation of saying, oh, this is a cause. It could be an infectious disease that was passed like herpes virus. Everybody gets chickenpox. That causes shingles. I
got chickenpox twice somehow, though. Everyone said that's supposed to be impossible. It's like, but then chickenpox comes at me twice. I don't even know how this happens. There's probably a few different variations of it or something.
You're very special, I guess.
I don't know. That's what they said. I was itching myself. My mom was like, wow, you're special. I'm like, that doesn't feel special.
But I think the more we can make those connections to say, okay, if you have been exposed to these factors, infectious disease, definitely genetic components. But even with that now, where it's sort of like, okay, if you've been in the family, you've had breast cancer and there's biomarkers like the BRCA or something, the fact that if those can be even improved, because that's what ultimately makes the decision of like, okay, what do we have to mitigate by changing diet, surgical things like that. But that's the hope, is we continue to understand that causative pathway between you have a risk for it, but how much is that risk, or is it a certainty?
Right. Because that's where I'm interested in things like a CRISPR.
Yeah.
And it's always, I'm always a little fearful of like, I do think the human body in a sense is perfection. However, you get on Earth and things change quickly. What level of prevention is also could potentially create more issues, right? Where it's like, you could maybe CRISPR yourself at 30 years old and say, I'm not going to have different types of cancer. But then what do we know what could be potentially like these other offsprings, right? It feels like we always are opening Pandora's boxes every single time we're shutting things off sometimes.
It is, and biology is a balance because it's sort of like geology, whereby you look at the layers of sediment and it was like building on top. That's what biology is through survival. It's not this precise organism that was formulated. Great, I'm done. It's like, nope.
Right.
These, it's through the evolutionary process, like, oh, that killed that. So, okay, let's do this to improve, blah, blah, blah. But it's always piling on. And you don't know what's in the background in terms of, the viruses and all.
Well, I think it's sometimes interesting, like historically, people like cancers come out of nowhere so recently in like the lineage of people. At least this is from my very lack of understanding, right? But then also I think maybe twice about it and go, well, people are just living way longer. So we're going to have different elements of length of age, that when you had pharaohs dying when they were 18 and they were like of age to like pass away at 30, absolutely, how would you know what happens at 90?
Yeah.
And we're trying to not only keep people alive at 90, we're trying to keep people like comfortable.
Yeah.
Right. And like productive. We have 80-year-old presidents now. Like, what are we talking about? Like, like the fact that we even have the mental capacity and the energy to do some of those things, that's a scientific anomaly in so many ways.
Yeah. Well, and it's funny because I'm sort of a history buff. So back in the 1400s, so Venice had the longest running republic, 1400 years. Their doge, who's our equivalent of president, typically was 80. So
really?
Yeah.
Okay.
And it's funny how, technology rises.
It's like that cheese and wine somehow.
Oh, God.
They just like, because it's one of those blue zones, right? Where they're just eating like white fish, cheese, wine, and they just live forever.
And, one of my heroes, Marvin Valcourt, who organizes, he's our marketing director that organizes LA Best. I told him, like, I want one of those Parmesan wheels broken open during LA Best because that's living. And that wants you to, that's probably part of the reason they live that long, because having such great food to look forward to.
Yeah. So you get to work with so many interesting individuals. You have different organizations and different people that are coming in and showing you what they have and that they're trying to work with you on. Who is it out in the field that you're inspired by, that you think is not only just your own organization, but other people that we can kind of, that someone listening to this could kind of look into and go, I just want to educate myself on who is like really leading the way on some of these nuances of the future?
Wow. There are so many people at UCLA that I call them sort of Renaissance. That, you'll find out, they're leading, they're an MD, PhD. They're leading an organization, but then they're also a producer on the side.
It's like, how many titles do you need?
Yeah,
it's like,
totally.
Leave some for other people out here.
and so there's several. So within UCLA, there's several, and there's also so much potential. So for instance, Dr. Ari Beldegren, I sort of call him the godfather of LA biotech, because he's surgeon, urologist, UCLA, he's one of, started Kite Biopharma, one of the first immunotherapy companies. He sold multiple companies. Now he's a venture fund and others, and he's expanded his network breadth, and he continues to be a successful entrepreneur in that field. And when I teach classes on this to aspiring faculties, I'm like, yeah, that's great to want to be Ari, but there's many ways to be successful in this business through your current role. And typically like that, those are like the scientific officers. Like for instance, like Dr. Michael Jung, he's our med chemist. So he actually works on the compounds that are used to treat, they're actual drugs, what they call small molecules.
Okay.
That, and he, with Dr. Charles Sawyer, invented 2 of the top 5 prostate cancer drugs that are on the market today.
Interesting.
But that's a different type of person to emulate, because he knows his role in chemistry. But what he's done is partnered with probably 24 biologists, because they know the biology, they know the disease, and he's like, all right,
he knows how to collaborate.
Be the one to target that.
Yeah.
And it's a beautiful thing, because it's knowing your role and how you can be successful, but also being in that translational side, stepping beyond the basic research.
It's so right. I studied real estate and entrepreneurship in college, and one of the things that I wanted some of our real estate professor or our entrepreneurship professors to do, like in the future, was instead of having all these like super like gung-ho, like coffee fueled entrepreneurs in the place, like having more like collaborative classrooms where like the entrepreneur kids would go and like do a cohort with like the science kids, and then do a cohort with the engineers, and having those types of interfaces are how things actually like give breath to new ideas and allow things to really happen. Because a bunch of coffee fueled entrepreneurs usually don't create anything other than a TikTok account.
Well, and that really is the essence of LA Best when you said that, because going back to UCLA, where we have a hospital across the street from engineering school and next to School of Medicine, I tell people we don't do quote unquote science projects, like siloed science projects. They're running into each other. Clinicians are treating patients and going back to the lab. And and with LA Best, the way we've set up that event, which by the way, in my mind, it's one event, but there's a mission vision of driving that type of raising awareness to drive collaborations. We set up a learning lounge, and it's with our stakeholders again, whether it's venture capitalists, IP attorneys, they want to help. But getting that exposure, and I tell people, learn from my mistakes. The introverted scientist. You're sitting at a podcast today is like,
you were introverted at some point?
I was always introverted. Yeah.
Okay.
Yeah.
You just know how to like crawl out of your hole every once in a while and figure it out.
I thrive again on self-deprecating sarcasm. So maybe that's the thread. But it's that Mark Cuban mantra of the first no leads to your next yes. Getting out there, networking, getting mentors, leapfrogging from, yes, you're building your scientific career, But if you want to make a difference and be part of a team that, launches the next cure for disease, it's building those complementary teams, assets in parallel.
Right. Yeah, because I think about some of like the scientists that you're working with that are the engines of all of this.
Yes.
And I think of these individuals like probably a little bit eccentric and but highly curated and really know what they're doing. And I wonder the difference between and it's probably everyone's human, so it goes either way, but just the ability to also take that risk of going, you're so good at staying in your numbers, but let's take the risk of where those numbers could lead to and where this data could lead to and your research could lead to, and broadening that reach, just constantly just reminding them dude, you're this is unbelievable. Let's just talk to some random business consultant on what we can do next. And
well, what's exciting is we're seeing all the way through undergrads now an appetite for biotech entrepreneurship, which is exciting because, to your point, there's basic research is phenomenal. Staying in basic research is great, but being exposed, seeing what's out there by coming to an LA Best or other events to, again, put your toe in the water, because that's where the serendipity happens. Right. And that's where you hear all these entrepreneurial where it's that's it, but it's chance favors the prepared.
Right.
So if you're focused on your core science, brilliant, and you want to stay in that lane, brilliant. But then if you're you want to explore beyond or, into that next realm of translational development, a startup company, then you see what's out there.
I can almost think about some of these guys as almost these artists with these masterpiece paintings. And, it's one, do you want to kind of sell this painting in a way, which is all artists say no? Or are you willing to go into a room that people are going to say, well, have you thought about adding some green to the painting? And it's how do you get the artist to be willing enough and vulnerable enough to be willing to have that type of input on some of the things that they've generally dedicated their whole life to? That takes a huge level of humility to be able to kind of break that threshold.
Yes, humility is a good word, because you're right. In the lab working on it, and then realizing, wait, to develop this into a drug means formulation. Is it stable? Clinical
criticism, on a higher, a totally different level.
Yeah, and things that, again, on paper, it's sort of like business. Okay, people do science, and then the other people do the business. It's the most powerful are the ones who are multifaceted, and I just go back to, again, Bulls fan. I used to marvel back in the day, Jordan, greatest player ever. Horace Grant would take that one dribble and bury it and be like, wow, that's powerful. What's the next one? LeBron James, same size, can do all, or even when Shaq between the,
it just continues to evolve and get bigger. It's
and back then it was no, you're power forward. This is it. You post up and all that. Whereas when you see the synergy, that how much it improved their capabilities by saying, just because you're big when you're young doesn't mean you can't dribble the basketball. And build those skills, because it provides options and opportunities. Mm-hmm. So the same thing with whatever you're saying, humility, humbleness, you're focused on this area. But if you come to an LA Best to build your network, then you get insight. And again, you can choose what you want to do because you're the thought leader. You're the expert to do that. But also related to this, we have stories of clinicians who have come to this. We have at UCLA, it's called the UCLA Innovation Fund. We'll put some money into promising research before it's become a company. And there's one story.
What's some money to you?
Well, some money this is up to $200,000.
Okay. Yeah, I just wanted to know. I had no idea what some money is.
Yeah, sorry.
It's not $2,000. Yeah.
It's not $2,000. And also when you look at the business of biotech, it's typically millions of dollars in the basic research stage. Then typically another million or two before you get to what they call an inflection point where the business will want to invest in it. There's this sort of gap.
Is most of the associated cost the individual itself? Just to be able to have a fully dedicated scientists on board for a 3-year runway when it's like a $200,000, right? It's like, I look at $200,000 as someone who built a business, and unfortunately it's no money, right? Not because once you put 3 people in the room, $200,000 is no money. And that's that's back in the days when I was getting out of college, because you're building it. You have product, you have inventory, you have houses, you have futures, all these things get crazy quick. So when you're coming to that, is it usually the scientist that is you're mainly funding at that component in time to be dedicated to it?
For this particular fund, yes, because it is funding for the laboratory. So to your point, it is saying, okay, you've got a promising compound. Let's try the formulation to see if it works.
Sit in it, just like
or
be there.
Yeah. To the next tipping point to show that it may work.
Mm-hmm.
But to your point, yes, it's very expensive, because similar to other industries, right? Whereby if you're mass producing an iPhone, and you can't have the screen's variability by what? Fractions of millimeters?
Mm-hmm.
It has to have that type of precision. So as you advance with drug development, even things that aren't really recognized as major expenses, but the manufacturing component of it, anything when you're doing small scale is much more expensive than when you have the scalability of volumes, but every single project is typically unique, that it has all that setup cost, and you're doing it one time or a few times. So the expenses.
And the thing is like, even with the smartest people in the world, we always think that, for some reason, I don't know why people get in the head that people don't make mistakes or over project or under project. It's like, that's all humans do, is we make mistakes. The best people make mistakes really quickly and get over it, and they use it as lessons.
It's also trade-offs, right? With everything. So if you're doing a clinical design, which is driven by statistics, that you want to get to that 95%, success rate, the more power it, which means including more patients, you increase your chances, but it's more expense.
Yeah.
And there's also recruiting times and things in it that, again, to your point, it's judgments, it's trade-offs. And if we knew the answer, then a lot of people would be.
And you're in such a heavily regulated market too, which that's because I was watching this documentary on Air Force One, and they're rebuilding it, I guess. And, they under budgeted by a $1 trillion of a plane. Yeah. What are we talking about? But what ended up happening is they tried to refurbish the style of the old one, and some new FAA regulation changes where the wiring can be on the plane. And these different bundles of wiring have to be further apart than they used to be. So the old plane got kind of grandfathered in, and now they're like, well, new regulation, you didn't foresee that. That unforeseen change cost taxpayers $1 trillion.
Wow.
But that's your world.
Yep.
You live in that crazy, chaotic world where, one, you can never predict where legislation is going and what other nuances of regulation kind of come down on you, but you already have 1,000 other things to think about with it.
Yeah. And I'll just go back to the LA Best essence of building collaborations and relationships. You see the agencies now, like the FDA, establishing a relationship with them early is welcome. It's encouraged, because it's the same thing. It's all people trying to problem solve, but it's good to get insight from the ultimate authority, the regulatory agent, early. And also having people do that, because selective hearing, when you go to an FDA meeting, it's typically not you must do, but it's we recommend. And then if you're new to that, they're like, oh, they didn't say no. It's no, read the room. We
got FDA approval for our device. It was called JuiceBot. It was a raw, organic, unpasteurized juice machine, kind of like a red box for juice. And we still currently are the only FDA approved people that can dispense an unpasteurized liquid in an unattended device. So which means you can touch a touch screen, and an unpasteurized liquid could come out based on our different detection methods, sanitation methods, all these variety of variables. And it was unbelievable to me I don't know how many meetings it took us. It maybe took us 15 meetings with them to get it across. And the last meeting that finally got it approved was actually them finally understanding what we were saying.
Yeah.
And it was like a light bulb finally turned on. And it was we're like, they're like, we get it. And we're like, wait, so we're good? And they're like, oh yeah, we're good now. And obviously there's huge approval letters and stuff. And for some reason they told us to send all of our information to them on a CD in the mail. At one point, we're like, can we email it? They're like, oh no, we're still doing CDs over here. We're like, oh, okay. This is going to be a little difficult. But that is, and we're talking about like, this is one of the most simple systems you could ever build. We just were trying to learn how to articulate what we were doing the right way. Yours are like unbelievably complex.
But you raise a great point, because the pitch, right? Making sure that you're communicating clearly so they understand, because it's easy for people to incorporate their own biases, assumptions, or things of that nature. And yeah, once you got them to that aha moment, that's brilliant.
Yeah.
But that's another attribute that we're trying to teach, here, because again, here's the other thing. When you're a scientist, you always, it's always this, you're trying to convince. So what do? You start with the data. And it's like, no, that's not business.
It's just not sexy. Everyone's like sleeping.
The significance, right? So
right.
Flipping what you said about, if you had that aha moment in, the very beginning, and this is not blame or shame or whatever, because just people being people.
Well, we were idiots. We were like college student idiots trying to figure it out, talking to FDA. We didn't know what we were doing.
Yeah. And again, I give you credit. You went through that journey, because that's the essence of what we're trying to do here with tech transfer. You go through that journey. And the first time is like, you did not run out of money or close down or fail or whatever and never get to that aha moment. You survived. Congratulations.
Yeah.
Imagine if we can convey that and teach them to do it earlier, so they're having those type of practices in a classroom or something, that by the time they get to the real deal, they've done it several times, or they have the right mentors or things. You've taken the risk out of it and you've increased the chance of success.
I mean, our first meeting with them, we were so certain we were going to get approved. We were worried more about what suit we were going to wear before the meeting. You know what I mean? We're like, we got this. We've worked on this for 3 years.
They'll be thanking us.
We're just going to explain this real quick. We're real witty college kids. We got this. Our founder and CEO was a brilliant dude, like all of it. But yeah, you learn a lot. Yeah. You're like, oh shit, read the room is like by far one of probably the most important elements of that, of trying to figure out how to do it. That's awesome. So LA's Best, you're putting on this event.
Yes.
And how are they getting invited to this? Is it anybody can kind of come? How do you build out the different individuals to curate a room that can have such gravity of positive impact for the future?
Well, that's a great question, because when I started UCLA TDG, I did not intend to build LA Best. And by the way, this is a team effort, because and so in the beginning, where it started as UCLA Bioscience Innovation Day, it was like, look, if we want LA to be, another biotech hub, and when I say hub, sort of like with Boston or San Francisco, you're not saying I'm going to Harvard, I'm going to Berkeley, great institutions, of course. It's recognized and branded as a hub of biotech. People go there. So with LA, UCLA is one institution, but LA Best comprises Caltech, City of Hope, Cedars-Sinai, USC. And that was the first peg, was getting all the institutions to participate. So it's one-stop shopping.
And then when did you start this?
2018 was our first year.
And no one else was doing something like this?
No, because, and this is, I think...
So unique when that happens, where you're like, let's start doing this. You're like, how have we not? We're just talking about getting a bunch of people in the room together and like, let's get the conversation moving.
Yes.
Right? Tell people what you're doing. Be vulnerable. And then before you know it, humans will be humans, and they'll start thinking, and they'll go, oh shit, I could maybe work with you. I see something here.
Yeah. And sometimes, what seemingly is obvious in retrospect, we're better together.
100%.
So for biopharma that used to fly over LA or go from UCLA, next day Caltech, next day, whatever, it's like, oh, they're all going to be there one day. Great. That's an efficiency. I want to go. So first, by recruiting the institutions to LA Best, brought in some of the key biopharma players. And it's great because Amgen's in our backyard. Ari Beldigran had just sold Kite to Gilead for $12 billion.
Whoa.
So yes, part of the cancer immunotherapy, the significance of that,
Right.
just, new treatments, whatnot. But you brand it LA, you bring in the main players, and then my two of my sayings are align and leverage, which this is scaling. The other one's fear and greed. It's still an industry. So when everybody
100%.
knows you have the institutions and these luminaries that are going to be there for 2 days. We have Lasker Award winner Dennis Slayman, who is an inventor of Herceptin, one of the top cancer drugs.
Okay.
He's going to be at LA Best this year
Cool.
on a panel. So that's what draws people in. So then all of a
So they're
sudden,
talking about their experience of
Yeah.
building that drug, how the team serendipitously kind of formed to,
Well-
to hopefully inspire others to say, you can do it too.
and also what's called deal flow. So in other words, when you come to this event and you start meeting the researchers that I say, you may not know them, but you should, because Lily Yang, who's now a top 20 female entrepreneur of the year because she launched a cancer company called Appia Bio in LA 2 years ago. She was a professor spotlight. That was our 3-minute hook. I'd go to him, you're a thought leader. You don't need more than 3 minutes. What's your vision, mission, blah, blah, blah. So Lily Yang, Yvonne Chen, David Nathanson, who have all these cancer companies, and again, I'm not saying LA Best or Professor Spotlight was the reason for success, but it's just
You could say it.
serendipity. Oh, you said it, so thank you. I can neither confirm nor deny.
Yeah.
But seriously, what that leads to your question is this, branding and expectation of like, oh my gosh, these people are going to be here. And not only the ones who are successful that are currently, with their companies, launching companies, new institutes being built, but then the pipeline of their mentees and the research programs that haven't been promoted or whatever, because it's the researchers doing their things. But when you find out that there's tens of millions of dollars and there's collaborations between UCLA, Caltech, City of Hope, it's just like, oh my gosh,
Yeah.
I want to be there, monitor, and get to know them.
There's people here, there's collaboration here, there's
Yeah.
money here. Like this is where this is kind of a launch pad of everything. That's a beautiful thing. Well, I'm excited that you've been able to, put yourself, having a person like you with like humility and foresight and the jack of all trades traits to, realize pulling smarter people in the room is the only way that we get anywhere in this life. I think it's a beautiful thing.
Well, thank you. And I tell you, I just tell them like, this is not that difficult when I tell them you've done the hard work. You're a professor at UCLA or Caltech, right?
Yeah.
You've checked those boxes. You're credible. I'm here to set you up, right? It is like dating. And when you have the right people set up with the right, attributes, then the rest happens. It's not, but it is setting them up for success in a way that they may not think about it. And so those are the challenges, but the opportunity with the next generation of entrepreneurs that will be that much more better equipped for delivering, curative therapies.
Right. And just getting these people that are already giants or already have achieved so much to say like, are you willing to kind of like put the cleats back on even sometimes and like go at it again, like go on another journey. But everybody needs that. That's how we live longer, is being excited about what we can do to achieve a more positive future. So
without a doubt. And that also is just a testament to the character of these folks, because there are many who it's your point.
they can be chilling.
They could be chilling.
Yeah.
They could be.
100%.
And they choose to do the next company, because it's the right thing. And on top of it, when, when you have folks like Yvonne Chen, who with her company's Impact Bio, with her research that led to her cancer drug, when it was tested in a clinical study, 8 of 10 patients survived. These were 8 patients who had probably run out of options.
Right.
That's powerful.
That's crazy.
And that goes beyond the money.
Like it was like
That's
those 8 of 10,
life-changing.
like this was a 10 of 10 death rate.
Yeah.
And then 8
Yeah.
of 10 are surviving. That's unreal.
And that's where, with tech transfer innovations at the universities, it's coming to that point, because as the capabilities, now we have the California Institute for Regenerative Medicine with their $8 billion are directly investing in clinical studies at the universities.
Yeah.
You're seeing this happen at the university level. So things that used to pass on to the pharma companies is happening here. So it's an honor and responsibility to be in the middle of that, of saying, okay, got to find a license or help start a company or things, or, complement, and God forbid not be a bottleneck to, the bigger picture, the mission of, helping patients.
I love it. Last question. And I know you're too busy to probably have an answer for this, but did you watch Succession this week?
That's not my show.
Okay. Because they just launched a new product called Living Plus. And it's like this extended like healthcare facility. It's supposed to be intertwined in tech. It's all bullshit. But they're prolonging people's life, making them feel more comfortable, creating those communities. Only problem is I didn't see any pickleball in there, so I was like, who's living without pickleball?
Yeah. It's hope reigns eternal. So let's just hope it doesn't lead to the Matrix. That's all.
That's right. Well, I appreciate you coming on here today, and I wish you a lot of luck with this event.
Yeah, no, thanks for having me, and look forward to next time.
Lovely. Appreciate you.
Thanks.
I need to know everything, who and the what and the where, I need everything. Trust me, I hear what you're saying, but act like it's new what you're telling me. I'm curious, George, I hop in the Porsche, 5 and a horse, I'm ready for war.